If you're like most of my patients, you've probably been told that your labs look perfectly normal, even though you feel super exhausted. Maybe you're sleeping, eating well, taking all the supplements, doing all the things the internet tells you that you're supposed to do, but you still wake up feeling really tired, you crash in the afternoon, or your body just doesn't feel like you have the energy that you used to have. Now, this is one of the most common frustrations I hear from people that I treat that are dealing with fatigue. And here's the problem. A lot of the basic lab panels, while they can be helpful, they don't always tell the full story. So today, I want to walk you through 10 panels and patterns that I like to order and review whenever someone has a complaint of fatigue, but their basic lab tests don't completely explain why. And I need you to stay with me because some of the most important markers are not the ones that everyone's talking about on the internet, especially when it comes to liver, metabolic health, cortisol rhythm, nutrient demand, mitochondria, and gut-related fatigue. But before we dive in, one quick but very important disclaimer. While I am a licensed practicing doctor, I'm not your doctor. This video is for educational purposes only. It's not meant to diagnose, treat, or replace any form of care that you receive from your own healthcare provider. Fatigue can come from some simple causes, but it can come from some pretty serious medical issues. So pretty much from this point forward, I do encourage you to work with your licensed and qualified physician, but I just want to give you some insight on some of the things that may help you to better understand why your normal labs aren't telling you the full story. So stick with me. So before we dive into the individual labs, I want to talk a little bit about the normal phenomenon. And oftentimes the normal lab results, they're not necessarily normal. It just means that it really isn't flagged for one particular problem. It's not telling you or your care provider that your numbers are optimal. It's just giving you some ideas that you fall within the reference range. And an important thing about those reference ranges is that they don't really come from the healthiest people within our population. Typically, these standard reference ranges are produced based off of individuals that are pretty sick, they're going for their lab tests, and they fall and they create that, again, standard bell curve or that reference point that we're using to determine who's sick and who's not sick. Individuals who are getting these tests, they're often branded as okay enough to go home and be fine. And those ranges that are really in the danger zones that get flagged as too high or too low, those are the individuals that need more immediate care or hospitalization, essentially acute care. So just keep that in mind whenever you're told that your labs are normal. Most of the things that I can see is they really do miss a lot of the early dysfunction patterns, right? So nutrient insufficiencies, a lot of problems with metabolic stress, or even some of those early developing patterns where you can intervene and make some changes before they become pretty catastrophic. Now, one of the main things about fatigue is that there's really no one magic marker that's going to solve the entire picture. We're looking for general patterns here. We're looking for a big picture approach. And we want to keep an eye on the things that make your body generate energy or make your body function. So we're looking at oxygen delivery, we're looking at nutrient status, we're looking at thyroid function. We also want to get a sense on what your blood sugar looks like, maybe some inflammatory markers, essentially looking at stress and the rhythms of your body, how that stress is supposed to be managed. And so one of the other big ones is liver function, metabolic function, gut health, and mitochondrial demand. So we're going to try to walk through some of these major areas. I'm going to piece them all together for you to basically understand why your labs might be normal, but there might still be something actually going on underneath. I've had someone recently that I worked with that we were going over their lab panels and it just didn't look like the person who the lab values were told everything was normal. And then when we went through all of these different subsystems and took a look at what was actually going on, we were able to see that a lot of these lab values were either on the really high end, but they were still flagged as normal, or the really low end, but also really still flagged as normal. So being able to tease apart exactly what's going on those lab results versus what you're experiencing is very important. One of the things that I like to tell my patients all the time is that I don't treat labs. I don't treat lab values. I treat people. And so if you're experiencing something or you're feeling like something is off, it's really important to really dig through what's going on with you specifically with what's showing up on those lab results. So let's talk about some specific ones. So one of the first places that I like to start, it's the liver. The liver is really, most people just think of the liver as a detox organ, right? So it's just this detoxification, nothing else. But the liver is responsible for a wide variety of different things going on in your body. Now, In a standard lab test, you can look at the liver enzymes, and there's a few markers that can tell you about liver health. You have your AST, your ALT, there's another one called GGT. You also have bilirubin. Another one that's most uncommonly thought about as a liver marker is the triglycerides, also glucose, hemoglobin A1C, insulin, and sometimes some of the cholesterol panels as well can all be associated with how your liver is functioning. These can give you some clues as to what's happening with your metabolic stress levels, any tendencies towards fatty liver, which could be pointing you to poor metabolism and poor energy breakdowns. It can tell you about alcohol effects and how the alcohol is affecting your liver, any issues with medications or the burdens of some of your medications, oxidative stressors, or even insulin resistance can all be pointed down towards that. So one of the big takeaways here when you're looking at these liver enzymes and the liver function is that the liver is a detox organ, but it's not only just a detox organ. It's involved in so many other systems. And so it's important to take a look at the liver whenever you're talking about fatigue and how this person is feeling in the big picture. Now, the standard liver tests that you may see might not show anything with regards to how your liver is functioning. Typically, liver abnormalities on the standard test panels, when something again is really wrong, again, usually some type of fatty liver disease or trending towards some fatty liver disease, and acute liver injury, hepatitis, and maybe even liver failure. Typically, what you want to look out for is signs of liver dysfunction, right? So you want to look for how is your body functioning? How do you do when you come in contact with substances? How do you do or how do you feel when you have a cup of coffee? How do you feel if exposed to alcohol? Or even how you feel when you walk into a room that has a lot of fragrance in there. These can all be some giveaways as to how well your body is actually detoxifying and interacting or interfacing with the environment. And if any of those are a little bit off, it could be an indication that maybe your liver needs some additional support, and maybe we want to ramp up that improvement in liver function. One of the things that I've seen is I've seen a wide variety of different conditions all tie back to the liver, and again, be able to tease out that there may be some further liver dysfunction just based off of how the individual presents. Sometimes one of the only things that you can see is just some borderline liver enzymes and nothing more than that. So keep an eye out for those borderline liver enzymes. Usually most individuals are looking at the high normal borderline liver enzymes, but sometimes you actually want to look at those borderline low liver enzymes, right? Because what do those borderline low liver enzymes sometimes indicate? Usually it's pointing you to a nutritional deficiency. So poor nutritional intake of proteins often will result in some lower than optimal levels or low normal levels of some of those liver enzymes, AST and ALT being those two primary ones. Now, the next one that I want to talk about is super important. We're going to be talking about cortisol, stress rhythm, and sleep. Now, I want to be careful with the use of the term adrenal fatigue. I know that will ruffle some feathers because adrenal fatigue isn't technically a legitimate diagnosis. However, the idea behind adrenal fatigue is really important. One of the things that I've run into online more recently is this concept of the cortisol detox. And a patient asked me about, should I do a cortisol detox? And I wasn't exactly familiar with what it meant until I looked into it a little bit. Now, one of the things with the cortisol and understanding what cortisol really is first you have to know that cortisol belongs on a curve. It belongs on a pattern. And what most people expect to see when they test their cortisol is because they're associating cortisol with stress, that they want their cortisol levels to be low. That's not always a good thing, right? Lower than optimal cortisol could be problematic. What we typically want to see is cortisol rising up in the morning. So that's called your cortisol awakening response. You want to see a nice jump, a nice bump of cortisol first thing in the morning, helping to get you out of bed. We want to see that number increase because cortisol is an arousal hormone, right? That means that it helps you to wake up, gets you up and out of bed, gets you going. Now, as you go through the day, cortisol levels are supposed to naturally slow down and calm down as you get into the evening, because that helps you to get into that restful rhythm so that you can fall asleep and relax. But typically what will happen for most people is they'll see some abnormalities in their cortisol curves. So you may get that first morning spike. Sometimes it'll be too high, and that could be associated with almost like a waking panic. Sometimes it'll be too low, and that could be associated with that feeling of, man, I just got out of bed and I feel like I need to get some more sleep. Or sometimes you can get a nice peak in the morning, so you get out of bed okay, then that mid-afternoon slump kicks in. That's where you need that second, maybe third cup of coffee in the afternoon because your body is just not able to maintain those cortisol levels throughout the day. And then oftentimes you can get another type of pattern as well where the cortisol levels are just pretty flat throughout the entire day. And maybe you'll see a little bit of a bump in the evening when you're supposed to be going to bed, and it just creates a lot of disturbances. Now, that's really important as well, because typically if you have an abnormality or a slight elevation in cortisol towards the end of the day, that can actually be tied to a disruption in sleep. Because again, I mentioned cortisol is that arousal hormone, helps you to get out of bed and get going. So cortisol and sleep have a really interesting relationship with one another because cortisol and melatonin are actually antagonistic to one another. So what does that mean? When your cortisol levels are up, melatonin levels are down, and generally speaking, when melatonin levels are up, cortisol levels are supposed to be down. And so that melatonin is really what's going to help you to get that nice restful sleep, really be able to get there all that regenerative sleep that your body needs in order to really function optimally. So when you're thinking about cortisol, even outside of an actual lab test, what we want to keep an eye out for is, again, are you waking up tired first thing in the morning when you should be feeling refreshed? Are you getting that mid-afternoon crash during the day where you feel like you need that second, third, maybe even fourth cup of coffee? Are you getting a second wind at night, right? So before you're about to go to bed, do you feel all juiced up all of a sudden and you feel like you can get a bunch done and you want to go around the house and start to super clean? Are you getting 7 to 8 hours a night of rest and still feeling unrested? These are really important markers that are telling you about what's actually happening with your cortisol without even looking at a lab test. They're waking up sluggish, they're getting that second wind at night, and I'm like, this is what your cortisol pattern is going to look like. It's going to be pretty flat in the morning when it should be up, and then it's going to be higher in the evening when it should be down. And every single time, that's exactly what shows up on that lab test. So you can really get some insight about what the lab test is going to look like before you even see it, just based off of how you're feeling. So my next and most favorite bundle out of all of these is actually looking at B12, folate, B6, and a couple secondary markers, methylmalonic acid and homocysteine, anytime we're dealing with some pretty bad fatigue. Now, the reasons for that is because B12, folate, and B6 are quite involved in your body's ability to make red blood cells, to make sure that your nervous system is functioning optimally, to make sure that methylation is occurring, right? So all that DNA replication and protein production, as well as detoxification and energy metabolism. Now, these nutrients are really involved in those pathways. When I'm discussing this with my nutrition students and teaching them, there's about 400 plus different biochemical reactions that involve vitamin B12. And so a deficiency in B12 or even suboptimal function of B12 can result in some poor functioning along all of these different pathways. Now, one of the reasons why I like homocysteine and methylmalonic acid is that these two markers, one being an organic acid and the other being an amino acid, can give you some insight into whether or not a deficiency is coming way before it actually shows up on a lab test. Because the nutrient that you have, those B12, folate, and B6, they may show up in your bloodstream, and they may do a blood test and it might show up that, hey, you have plenty of B12, folate, and B6, but what's actually in your blood and what's in your organs are two completely different things. Your body may not be able to absorb and utilize those nutrients effectively, and so you may see signs of deficiency earlier when you check out those patterns than just looking at blood tests alone. Typically, some of the symptoms that you want to look out for before you do a deep dive on these are obviously some fatigue. Brain fog is very common. Some numbness and tingling can occur. Mood changes, memory changes, loss of concentration. Also anxiety. I've seen some depression as well with them and some digestive concerns. Now, I typically don't recommend just going out and mega dosing B vitamins, particularly vitamin B6. Wild B6 deficiency can cause some numbness and tingling. We call that paresthesia. High doses of B6, so B6 toxicity, can also cause some paresthesia, oddly enough. So you don't want to just go ahead and supplement that unless there's actual deficiencies showing up on a lab test, whether it's a standard test or a functional panel looking at some of those organic or amino acids, okay? One of the things that I've seen in the clinic is you want to also keep an eye out on maybe some dietary things that you're doing. So one of my patients that I had dealing with chronic migraines, fatigue, brain fog, really had a hard time just getting through the day, saw some of the best specialists in the world, went to the Yale New Haven Center for Neurology and got all the different workups, different CT scans, MRIs. They couldn't find anything wrong and they checked everything. Turns out she was a vegetarian. Her family predominantly just ate vegetables, occasional meat here and there. And then when we did some tests, a little workup, there was rampant B12, folate, B6 deficiency, nutrient deficiencies up the wazoo. And you could even just look at the patient and tell the coloration was off. They looked drawn. They looked really tired. Their body didn't look like they had very many nutrients in them, honestly. Body weight was on the lower side. And it was just a clear case of supporting with the nutrients. The minute those nutrients went in there, symptoms improved almost immediately. I'm talking within days. Symptoms improved when we started to supplement at those right doses to get those levels up. And so really sometimes it's important to just look at the bigger picture. How do the symptoms, diet, stress, and lifestyle match up with what's going on? Because a standard lab test may not show anything. And due to the severity of symptoms, you would expect that some of the standard lab tests may actually show up as abnormal. They can last for months to years within the normal range before even changing once. So keep that in mind. Okay, so another fan favorite. I am always looking at thyroid, but we got to do thyroid beyond a standard TSH. The thyroid is a classic area of fatigue, but most people really only have their TSH checked. The problem with that is that the TSH is a brain hormone. It's not a thyroid hormone, so it's not giving you tons of insights on what's actually going on at the level of the thyroid. You really got to do a deep dig there. You got to look at your free T4, got to look at free T3. You also need to look at thyroid antibodies, because if your thyroid antibodies are off or they're elevated, no matter what you throw at it, you're never going to really get the thyroid functioning the way that it needs to, because those antibodies can either be blocking or stimulating. Now, some of the most common thyroid symptoms that you may have along with some of that fatigue is cold intolerance. You may see some constipation, particularly in the hypothyroid state, where that's a lower functioning thyroid. You may see some dry skin and hair shedding, alterations in mood, definitely see some brain fog. That's usually a really common one. Weight alterations, again, in the hypothyroid state, you'll see some difficulty with being able to lose weight. And that's usually tied to the slower or the slowed down metabolism that comes with that. Really and truly, again, that TSH is talking about brain signaling, and it can give you some insights on what's happening at the thyroid, because that brain and that thyroid should be communicating. And if the TSH is on the higher side of normal, oftentimes it's because the brain is sensing that the body needs a little bit more thyroid hormone and it's trying to ramp that up. But again, here's the deal, right? So if you're kissing that upper limit of the thyroid range, you may be normal technically, but then you could fall within that subclinical hypothyroid state, right? So that's where things are normal, but your thyroid is really showing signs of needing some additional support. So we may want to work on that a little bit more. We can look at whether or not your body is converting that thyroid hormone adequately. TSH looks fine, T3 looks good, T4 looks good, and then we run a marker called reverse T3. So that reverse T3, that shows up as abnormal or elevated. And the reverse T3 is ultimately what happens when your body is dealing with lots of stress. It could be stress from illness, or it could be emotional stress, mental emotional stress. But your body will take that T4, which is the kind of reservoir hormone that holds metabolism, and instead of converting it into T3, which is the functional part of your metabolism to get things going, it'll convert it over to reverse T3 due to those stressful situations. There's actually a nutrient deficiency as well that can cause that conversion to occur. If you're low on selenium, those enzymes that make that conversion happen will just shift everything else over to reverse T3. And you can see, again, some abnormalities in metabolism. Even though the numbers look good, the T3 numbers just aren't where they're supposed to be because of that one deficiency that might be going on. And then another one, again, you can see some pretty normal lab results. T3 looks good, T4 looks good, TSH looks okay, and reverse T3 looks okay. But then we check those thyroid antibodies and there's some inflammation brewing, right? The thyroid is undergoing some autoimmune attack. It's causing some suppression, but maybe not bad enough that it's causing a complete overhaul or disruption on that TSH. So we can get in there early and you can make some modifications and you can really get things under control from a holistic perspective on decreasing inflammation to help to calm that down and improve some of those energy markers. Okay, another really big one here is looking at blood sugar, hemoglobin A1C, C-peptide, and insulin. Now, most people haven't heard too much about C-peptide, so I'll definitely explain that a bit here. But this is where blood sugar really matters way before we even start talking about diabetes and diabetic situations. Now, these markers can show up sometimes normal way before, but when we look specifically at C-peptide and insulin, when we're looking at the blood sugar picture, we can see some issues with difficulty managing blood glucose or dysglycemia way before an even diabetic or hemoglobin A1C ends up in the pre-diabetic range, because your body might be working really hard at keeping your sugars within the normal range, but it can't keep that up forever. So if you're able to figure out that your body is working really hard to keep your sugars under control, then you can get in there and you can start making some modifications to calm that whole situation down before it even becomes a major problem. So you can see some of that insulin resistance again, months, if not years before an actual hemoglobin A1C or even a fasting glucose shows up as abnormal or elevated. Now, one of the things you can look out for here, common symptoms, is looking at those afternoon crashes. One of the best cases that I was working on was an individual who drove trucks for a living. And they were having an issue where every time they drove, if they ate, they would pretty much have to pull over and they would have to stop. And that would cause some pretty big issues for them. Having to stop every time you're trying to deliver a load can impact your income, it can impact your delivery timeliness, it could impact your job. And we had to figure out why every time you eat a meal, do you have this crash where you basically need to pull over and sleep? And it turns out there was some insulin resistance happening. And it wasn't just a little bit of insulin resistance, it was pretty bad. So much so that it was starting to creep into that hemoglobin A1C a bit, but everyone kept brushing it under the table because it was just pre-diabetes. It's not that big of a deal, but typically what's going to happen every time you have a carbohydrate-rich meal, if you're having that issue with your insulin resistance, is that your body isn't able to adequately respond to those carbohydrates from the meal until your insulin gets very high, and then all of the sugar from your blood rushes into your cells, resulting in a low blood sugar response, which is that hypoglycemia, and then you feel that crash where you almost feel like you're going to go into a coma. And dangerous hypoglycemia can land you into a coma. If your blood sugar drops too low in the 40s, you're going to be in a really dangerous position. So a lot of people really worry about the hyperglycemia, and it's important to worry about hyperglycemia. We don't want high blood sugar, but hypoglycemia is even more dangerous in the long term because it can result in some pretty dangerous issues, whether you're driving on the road or you're just even at home by yourself sleeping. It could be pretty dangerous for you. So we definitely want to address that very early on, and it's pretty easy to do that if we have the right tools, but finding it's the most important thing. All right, so if you're watching this up till this point and you're thinking, all right, I've had some of these checked and they were normal, this is where I want you to stay with me. I want you to lock in here because the goal isn't to look at these labs in isolation. The real question is, what patterns are these labs creating together? You can have normal glucose, but high insulin. You can have a normal hemoglobin, but a low ferritin. You can also have a normal TSH, but still have symptoms that should seem like the thyroid isn't doing exactly what it's supposed to be doing, and it needs to be looked at more closely. You can even have normal liver enzymes, but have a metabolic pattern that suggests that your body may be under a significant amount of stress. So as we move into the second half of this video, I want you to think less about the individual numbers or the individual tests that we've been talking about, and more about the story that your body is telling you as you look at all the patterns together. So here's another important one, vitamin D. But you have to look at vitamin D within context because online, sometimes they oversimplify vitamin D, and vitamin D deficiency is one of the most common things, depending on where you live in the country or even on the globe. Certain longitudes and latitudes don't get the right sun exposure typically throughout the year, and so that can result in some lower than optimal vitamin D levels. Now, the low optimal vitamin D can often be a clue at some other things. It can be tied to some other conditions. Usually, you don't look at vitamin D in isolation. You look at it in regards to immune system function. You want to keep an eye on inflammation. If there's any muscle aches and cramps, looking at bone health and bone density, very important for vitamin D. Also mood and autoimmune history, that's a really big one. And how much sun exposure you're getting throughout the year. So you want to ask yourself, are you getting enough sun exposure? Are there any supplements that you have that have vitamin D in there? Are you dealing with any digestive issues, right? Are you having a hard time digesting fats? So the vitamin D is typically a fat-soluble vitamin. So if you're supplementing vitamin D, but you're having a hard time digesting fats, maybe you're missing your gallbladder, really big one. You're going to have a hard time absorbing that vitamin D, and no matter what you throw at it, you're not going to really absorb it that much. Typically, one of the main things that we see there is maybe we're not supplementing enough, maybe we're not keeping an eye on the vitamin D levels throughout the year, and there can be some gaps where the vitamin D levels drop to a suboptimal range. Don't just go out and start mega dosing vitamin D levels. I see you can get 10,000 IUs of vitamin D over the counter and people are taking that daily. I've had some patients before where their vitamin D levels are way too high because someone told them on the internet to take vitamin D. High vitamin D levels can be dangerous, so they can cause some damage to your liver and it can cause some damage to your kidneys. So I don't want anyone just going out and high dosing vitamin D unless you know where your vitamin D levels are and you're doing sequential follow-up testing to make sure that they're staying within that optimal range. So again, depending on the lab, everyone has their own kind of special ranges. But as a functional provider, I like to see vitamin D levels between about 40 and 60. You want to see that between 40 and 60 and keep your levels around there. But don't just go mega dosing vitamin D because you can land yourself in a world of hurt. So this is another really big one that I see often missed is the inflammatory markers. So when your body gets inflamed, energy gets redirected to different places. Your body is not going to be focusing on cellular repair and increasing function if your body is dealing with inflammatory attacks, whether it's from an immune system, an autoimmune reaction, whether it's from a viral, bacterial infection, any of those different things, your body is not going to be in building and functioning mode when you're dealing with inflammation. And so a lot of times people think of inflammation in the negative sense, but inflammation generally does have a job to do, particularly when it's used in the acute sense and then clears up when the issue is gone. That chronic inflammation, usually you're looking at symptoms related to feeling really tired, heaviness in your body, lots of achiness, be feeling pretty foggy, any issues where you feel like you're constantly going through recovery, right? So joint pain, skin issues, gut issues, and frequent inflammation or frequent infection is a really big one there. So always feeling like you're fighting a cold or scratchy throat, that could be an indication that something more is going on as well. Now, you can use some standard blood tests for this. So there's two really big ones that people will look at, C-reactive protein and the sedimentation rate, so ESR. These are generally non-specific markers, so they don't give us much information about exactly what's going on inflammatory-wise, but it could be pretty helpful. Another marker that I like to take a look at is ferritin. So ferritin's a really important one because ferritin also rises in an inflammatory state. Your body will try and rid of as much of that iron from the system as possible, to keep it away from particularly microbes that can use it to cause damage. And so you can see a spike in ferritin, but typically you have to analyze that within the context of what's going on. Other issues, again, that you can see, autoimmunity, I like to take a look at. There's some standard screens for autoimmunity. It's called an ANA, anti-nuclear antibody. If you're having some of those recurrent joint pains, skin issues, feeling drained and tired all the time, it's definitely worth taking a look at the ANA and then also thyroid antibodies as well to make sure that those things are under control. A lot of times with autoimmunity, there can sometimes be some environmental exposures as well. So environmental toxin exposure and autoimmunity can go hand in hand. So if you're a person who is exposed to quite a bit of environmental toxins, whether it's mold toxins, mycotoxins, or you're exposed to different things on the job, to people that I work with, maybe hairstylists, you're exposed to a lot of different things there. I've worked with some petroleum engineers before that have had some exposure on the job there. And so you may start to develop issues as a result of what you're exposed to on the job. Even if you have good workplace ventilation and those types of things, your body will still accumulate some of these things over time. And it could be worth investigating that to figure out how to clean that situation up. So before we keep going, if this is helping you to understand your labs in a more complete way, do me a favor and hit the like button so that YouTube knows to share this with more people who are being told that everything is normal, even though they still feel completely exhausted. And if you want more videos where I break down gut health, hormones, fatigue, and root cause patterns in a practical way, make sure you subscribe. Now let's keep going because the next few markers are some of the most commonly missed pieces when people are tired and not technically anemic. So this is where most of the conversation usually starts when people are talking about fatigue, and it's the CBC. So this is the complete blood count test. This test is useful for far more than just determining whether you're anemic or not. There's a couple of other sub-markers that show up on the CBC. One of them is called the hemoglobin. There's hematocrit. You have the red blood cell count, which is really helpful. And you also have the mean corpuscular volume, or MCV, mean corpuscular hemoglobin, and then the red cell distribution width. Now, these can all give you a lot of information about how well your red blood cell can actually carry oxygen. So, oxygen carrying capacity of the red blood cell. It can tell you about the size of the red blood cell. So, the MCV tells you how big or small a red blood cell is. And if a red blood cell is usually, on average, smaller than it should be, it can give you a clue that there may be some iron deficiency. And if a red blood cell is a lot bigger than it's supposed to be, or that ballooning red blood cell, it can give you some insight on whether or not there's any B12 or folate deficiencies. It can also give you some insight on inflammation that you may be dealing with, because usually you also see white blood cells on that panel as well. So that could be very helpful. Now, you don't want to just look at the red flag components of the test. You want to go through it line by line. One of the most common things that I'll see is no one really looks at the pattern of the white blood cell counts. So I'll get some patients and I'll look at their pattern, and there'll usually be a percentage of where each thing is supposed to be located. So for the white blood cells, there should be specific percentages, and oftentimes those percentages are out of whack. And even though the absolute numbers are normal, those percentages can really be off and can create some issues where you're not feeling quite right. Maybe there's frequent infections. But again, it gets brushed under the table because the absolute values fall within the reference ranges. Those percentages can give you some insights on whether or not your body is fighting anything or dealing with anything, even though it's falling within the normal range. Eosinophils are a perfect example of this. I've had some patients where they were dealing with parasitic infections in their GI tract, showed really high eosinophil levels, and it allowed us to be able to do some specific gut testing to figure out which parasites were actually there, so that we could get them treated adequately. And that helped to resolve some of the fatigue. But without looking at those percentages, we would have missed it completely because the individual was otherwise healthy. And so a lot of parasitic infections that can happen in the GI tract in healthy or otherwise healthy individuals, they may not show any signs or symptoms at all, other than maybe feeling a little bit more fatigued, because your body is using all of your energy and resources trying to keep this infection in check. So now, I talked about ferritin before. Ferritin is a really important marker, but a lot of people only think of it as an iron storage marker. You can have a normal hemoglobin and hematocrit and still have pretty low iron stores. It's something that I see pretty commonly. Some of the symptoms of lower than optimal ferritin are usually fatigue, some poor exercise tolerance, usually issues with hair. So a lot of hair shedding, some restless legs, shortness of breath, pretty common, especially with exertion, and pretty low stamina. Now, the groups that I typically see this problem with is usually women who still have their menstrual cycle. You can see it sometimes in postpartum state. A lot of athletes, some dietary restrictions. So vegans and vegetarians usually will have some issues there. And if you're having really heavy menstrual periods, these individuals will burn through their iron storages really fast and can run into some issues. And the last group that I see some problems there are people who have gut absorption issues. So if your body isn't absorbing iron well, typically through your gut, you can have some issues. And usually a poor absorption of iron through the GI tract is often tied to a poor stomach acidity. So if your stomach acid isn't a strong acid, or you have a very weak stomach acid potential, you don't really absorb metals that well, but you don't really get those metals from the foods, particularly iron. And so you see some issues there with digestion. Now for this last section, this panel 10, this is usually where a lot of people get stuck, especially after having a lot of normal labs, is because in the Western sense, they typically don't see a lot of these tests get done. Organic acids, mitochondria, gut tests, and nutrient demand. So usually after you do all of the standard testing and you don't get a good explanation as to what's going on with your fatigue, it might actually be worth looking at organic acids, because you can actually get some clues as to what's going on with your B vitamins and how your body is utilizing some of those B vitamins. Now, organic acids are a byproduct of your own individual biochemistry. So as your body uses raw materials, it will either create organic acids or it will create the end product that you need to run the system. If you run low on the cofactors that keep those biochemical reactions moving forward, your body will run and create these organic acids again as a byproduct. And so when you see organic acids generally showing up pretty high on some tests, it can be an indication that there's some deficiencies going on with some vitamins or sometimes minerals that you need to sub in to help to improve the overall function of your body. Usually, again, you can see some nutrient issues, but I've seen some mitochondrial problems, so poor mitochondrial function. I've seen markers associated with oxidative stress, I've even seen some markers associated with increased need for detoxification or some microbial metabolites like yeast and other bacteria that can cause some problems like Clostridium. So definitely getting some organic acid workups can be pretty helpful. Sometimes it's a standalone. A lot of people don't like to use it just for diagnosis on its own. But if you've gone through all of the other workups and everything's coming up clear and you've looked at it and things are right where they're supposed to be, sometimes the organic acid markers can give you a little bit of a insight onto what's going on with how your mitochondria is functioning, what's missing. Because sometimes when things are missing from a nutrient perspective, we can see what the mitochondria will go into something called a hypometabolic retraction. It will essentially turn its metabolism off so it isn't generating cellular energy for you in the form of ATP so that it can survive any deficiencies in nutrients, again, particularly those vitamins and minerals that help to run the reactions forward. I've had some clinical cases of this where, again, we tease through everything, we run all the tests, we look at the low energy, the low ferritin, checking methylmalonic acid and B12, and just looking at all the different things, but then there may still be some sugar cravings, sleep disturbances, high stressors. All of these things can point to some mitochondrial dysfunction and some microbial stress. And then when we check it, we see some things showing up that shouldn't be there again because of a yeast overgrowth or, again, some issues with mitochondria taking on a lot of oxidative damage. So definitely worth looking at those if you've checked everything else out. So now the big goal here is just to remember that we're not looking for one magic answer. We want to try and organize all of these different things into categories. And the categories generally are how well your body can deliver oxygen, what your nutrient status looks like, how is your thyroid functioning, are there any blood sugar issues that we need to keep an eye on, are there problems with inflammation or unchecked inflammation, typically related to autoimmunity and things of that nature. How is your liver health and your metabolism function? Any stress or stress rhythm and sleep disturbances that we need to work on? And what's going on with your mitochondria and gut-related demands? So looking at any one of those patterns in isolation might give you some insight. Generally, it's more helpful to look at the big picture altogether and see if there's any main things that's going on, sometimes with some crossover between main systems. So one of the most common things, or another thing that I've seen is we had a patient with a lot of normal labs showing up. Ferritin showed up pretty low. It was very low range. And then we did some organic acid markers and we saw some other problems going on with B vitamins, magnesium deficiency, some poor mitochondrial function, typically due to some issues with absorption of nutrients. And so tying together that lower than optimal ferritin with some of the organic acid markers, I was able to see that this was a digestive issue. This was a poor diet, not getting enough proteins and nutrients, and really being able to address those from the root was able to increase this person's ferritin to a way solid range, calm down all those mitochondrial issues, and get their energy back to optimal. And areas of their life that they didn't even know was suboptimal started to improve. The color came back into their face, their hair started growing, their nails were growing. Again, things that they didn't even realize were missing because the fatigue was just so much. So next steps here is that I don't necessarily need you to go out and buy 12 supplements. It's important to start out with the proper evaluation. So we want to get the right diagnostics to do the evaluation and figure out what's going on. So the next real important step is when you're working with your clinician is to get the timeline clear of what's going on. Be able to explain to your doctor when everything started. Was it a sudden change? Was it gradual? Is there anything that makes it better or worse? What's your sleep look like? How are the meals? What are your eating habits? Are there any gut symptoms or any menstrual issues? Are you dealing with frequent infections? Do you take any medications or are you on any supplements currently? And then it's important to look at some labs that we discussed. So a general summary here is you want to look at the complete blood count patterns, looking at ferritin, a full iron panel, B12, folate, homocysteine, methylmalonic acid, some thyroid markers, looking at all the thyroid markers and the autoimmune markers as well for thyroid, looking at blood sugar, insulin, C-peptide, as well as inflammatory markers like the autoimmune ANA and ESR and CRP, vitamin D, and looking at the liver and metabolic markers as well that I've discussed before. Fatigue is not always just a simple nutrient deficiency. Sometimes it does require some deeper evaluation. So we want to look out for some red flag symptoms: chest pain, shortness of breath, fainting, unexplained weight loss, any blood in the stool, some severe weakness or any new neurological symptoms, headaches, or any rapidly worsening symptoms, all can be an indication that things are progressing relatively quickly and you need some immediate support. So if this helped you to understand your labs in a more complete way, please subscribe because I'm going to be breaking down all of these markers in the future, one by one, to give you far more insight onto exactly what's going on individually so that you can understand them in the bigger picture as well. We want to talk about ferritin. We're going to do more B12 and folate. We're going to talk about thyroid, blood sugar, definitely organic acids, liver, metabolic health, and the cortisol rhythm in more detail. So I want you to tell me in the comments, have you ever been told that your labs were normal, even though you still felt super exhausted? And if there's any specific markers that you were curious about that you wanted to know more about in the next video, let me know because I'll probably throw that up first. And as a final reminder, your symptoms are information. The goal is to understand the pattern and not to ignore the signals.